Hi, I'm Dr. John O'Brien. I'm Upper East Side of New York City, Manhattan, 34 East 72nd Street near Madison Avenue. I've been here for about 30 years and I'm affiliated with Mount Sinai Hospital and Lenox Hill Hospital. We do a number of things in our office to offer our patients. So, number one that I do besides annual wellness checkup, we do medical clearance. Medical clearance means even if you go 18 years old, you're going for rhinoplasty nose job to somebody who's 87 and has to have open heart surgery or brain surgery. You want to make sure that everything goes smoothly while you're on the operating table. The surgeon wants to concentrate on the task at hand to help you, whether it's cosmetic surgery or more to it. You don't want to have any worries. Anesthesiologists don't want to stop surgery in the middle if your blood pressure goes up or your heart goes fast. That's where we come in. Make sure you're okay before surgery. Make sure you don't have any bleeding disorder, clotting disorder. Make sure that if you smoke, we make sure your lungs are healthy enough to undergo surgery. Make sure all the other parameters are important. So today I get a phone call from a plastic surgeon, very prominent, that I have been helping to do the medical clearance. He asked me to see one of his patients we didn't do the clearance for, that the wound is not healing. Now there's many things goes on with poor wound healing, but this is the poor wound healing. If it's trauma, injury, gunshot, stab wounds, it's different, but not when it's nice incision. The surgeon puts on nice sutures. So there's a lot of multi-factor issues why this lady who had a tummy tuck is not healing well. Is it they're anemic? Is it that they have poor nutrition, malabsorption? And they don't tell you. So all factors goes in. So that's why it's good to get to know the patient before surgery, after surgery. Things happen. We both want to help the patient heal well without scars, without infection. So I would advise you to make sure you get your medical exam at least 2 weeks before surgery. Make sure everything is done right. There's no surprises the day of surgery. So if the lab is missing your EKG, for example, today we had a patient that is having surgery on Monday, and today's Friday, and they went to City MD to get the clearance. But City MD doesn't clear patients. They do labs, but they don't know what they're looking at. It's not their job. And now surgery's on Monday, 7 in the morning, and they're running around trying to find out what to do. So give yourself plenty of time, at least 4 weeks before surgery is ideal, 3 weeks, 2 weeks. Don't wait for the last minute. But even if it is last minute because you're coming from abroad and you don't have much time, we could help you with that. Good luck with your pre op medical exam.